Okay, it's your turn now to get advice from the dentist. Dr. Mark Hyman is here to answer any questions you may have about your family's teeth. The number to call right there on your screen, 800-807-8255. And we already have our first caller on the line. Jan is on the line in High Point. What's your question?
My question is, I have a 6-year-old, and she's complaining about her back molar hurting her. I would like to know, can I use Ambisol, or will her back molar eventually fall out?
Right. Jan, for a 6-year-old, the question is that a baby tooth? Is it the 6-year molar, the first permanent molar tooth coming in? So Ambisol sort of could mask a problem if something's going on. I think you ought to go see your dentist and see, is it an eruption issue, or is it a cavity issue, or a hygiene issue? Sometimes just from eating popcorn, you can get a little piece of popcorn packed around the gum, and that can cause pain. So I wouldn't want the Ambisol to mask something bigger going on. So a simple visit to your dentist could solve that.
All right, let's head to Kernersville now, where Margaret's on the line. What's your question for Dr. Hyman?
Hi, I had a root canal done, and 6 days afterwards, I woke up with numbness on that side of my face, and I was just wondering what your thoughts might be that could have caused this. Thanks.
Thank you, Margaret. When that happens, when someone's had a root canal and 6 days have gone by, usually there's some new infection brewing, and that happens often. About 9 out of 10 times when a root canal is done, that's the end of the story. About 1 out of 10 times the tooth needs to be retreated. So numbness that comes that much later probably wasn't from the shot. It's probably from some new infection or residual infection still brewing. So I would go see your dentist. It's Friday, the weekend's coming up. I would give them a call ASAP and just describe your symptoms and see what they think is appropriate.
Good advice there. All right, how about in Thomasville, we go to Angela. What's your question?
Yes, hi. My husband had a tooth pulled, a very abscess tooth, and he ended up with a dry socket and went back to the dentist, and now he's got more pain with these little white blisters, and I was just wondering what we could do about that.
Right. I'm sorry your husband lost a tooth. When you have a dry socket, it means you've lost a healthy blood clot. So I think it's important to go see the dentist and let them reevaluate it. What they may want to do is numb the area and kind of scrape around the socket to re-stimulate some new blood so that a healthy blood clot can form. When a dry socket forms, often it's because the area hadn't been kept as clean as possible, or you rinsed and spit too early in the procedure. So it doesn't matter what happened. How do we get him healthy as fast as you can? They may also choose to do an antibiotic. So I'd get seen again. The weekend's coming up. You don't want to wait till Monday because things could just get worse.
Okay, good advice. That sounds really painful. Well, let's head over to Winston-Salem, where Hillary is on the line. Hillary, what's your question?
I have my son who is 2 years old and has a minor cavity. And I was curious if I should go through the pain of having him have to go undergo surgery to get it filled, or wait till it falls out.
Right. Hillary, I appreciate your call, and I understand as a parent it's hard when you see your child's got a cavity that early. A couple things I'd want to know is, why is there a cavity that early in a 2-year-old? Are you all on well water? Is there a lot of apple juice in a nursing bottle, things like that? So we'd want to prevent the cavities. I would certainly go see a dentist. I respect when you say pain. Modern dentistry should not hurt. With a 2-year-old, the challenge is behavior. How are you going to monitor the little person? How are we going to get that done? And pediatric dentists and general dentists who enjoy treating children can do a great job with a 2-year-old. There's a lot of neat new things that we have in dentistry. Sometimes it's just voice behavior, discussion. Sometimes it's a little medicine the child can take to mellow them out and get the procedure done. But I'd go get seen immediately.
You brought in some props. We only have about a minute left.
Sure.
But can you tell us about this new kind of, it's an alternative to braces,
sure.
right?
And Shannon, this is Invisalign, which is really cool. It's constantly being improved on in advance. What people often object to with braces is they don't want to see the wire. They don't want to have wires come off, brackets come off. And with Invisalign, it's a CAD/CAM generated, computer generated set of aligners that you change about every 4 to 6 weeks, and it can move your teeth the same as traditional braces. The investment's about the same. The benefit is they're gorgeous. When they're on, you can't even tell that you have braces on. They can move the teeth beautifully. You can still brush, you can still floss, you can still sing and dance and kiss. So it's a really cool thing, a tremendous advancement in dentistry.
How much do you have to wear them, like all the time?
They're 23 hours a day.
Oh, wow.
What we really need is compliance. So if somebody doesn't have the maturity to do that, it's not the right time for this. But if they have the maturity in the right case, this is an awesome thing for dentistry.
Well, great. Well, I hope you have a great weekend. Thanks so much for coming in
Shannon,
and
thanks
telling
for
us
having
about
me.
all that.
Thank you.